Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi platform, joining us via multiple social media channels, YouTube, Facebook, Twitter, Instagram, and also via the Dr. Fundi website. Today, let me first start by introducing myself as the host to these very intelligent people that I've invited today. My name is Fundi Lenyati. I am the host of the channel. I have invited people who are experts, in their areas of, function as professionals. But I've also, got my friend from yesterday, Mr. Udelicious, to come and bring some spice and energy to our discussions today. As you all know, this is the month of September, which is a month that is designated Albinism Awareness Month. So yesterday we had a discussion. We invited a specialist dermatologist to join us so that she could give us the basics around what albinism is and also what are the kind of health challenges that they normally manifest with, especially when it comes to skin. We discussed many other issues, including human rights challenges. So that was setting a scene for today. Today, we are going to be looking at the people who are living with albinism. They often, have challenges that have to do with their vision, amongst other challenges that they experience. Now, what we have seen in South Africa and the rest of the continent, in fact, the rest of the world, is that as a result of some of the visual impairments and even disability that sometimes they may present with, they tend not to fulfill their true potential, as professionals, in their respective chosen professions. So today, we are going to discuss issues relating to impairment and disability that are related to or often found amongst people who are living with disability. I've invited Mr. Sbu Gumede. He's an eye care professional, but he will explain exactly what he does so that we have no question marks about, the kind of info that he'll be sharing with us. He's a gentleman that I've known for a long time, more than 30 years, so I trust that we are going to learn a lot from him. I've also invited Miss Rethabile Matolweni. She was here when we started. For some reason, she has just disappeared. But I'm sure she'll be coming back any moment now. But Rethabile Matolweni is a qualified occupational therapist. All right. Now, occupational therapists, there's a wide range of them. There are those who are involved in matters of education, in schools, and there are those that are involved in vocational type of occupational therapy. And she comes from the latter group, the group that is very active at finding solutions and assisting people, especially those who are working. She works for Metropolitan Health Group as one of the experts in incapacity and disability. So those are the people that I'm going to have today. Like I had said, I've also got Mr. Udirileng Mapaha, who is a gentleman that was with me yesterday, and he comes representing the Albinism Society of South Africa. So, gentlemen, and the lady who's still supposed to come in, welcome to the Dr. Fundi channel.
Thank you. Thank you very much, Fundi. Thank you, Ben.
All right. I think for the benefit of people who did not watch my show yesterday, maybe I'll start with you, Sbu, to just introduce yourself in terms of, your professional background, where you're working from, so that you get a benefit of exposure about your business as well. And then after that, I'll ask you, Untitled, to also just give a quick update about who you are, what you do, so that people understand why you are here. Yes, I've already mentioned that you come from the Albinism Society of South Africa. Okay, so right. So Sbu, let me start with you.
Good evening to you, Fundi, and the rest of the panelists and all the followers of this digital channel. As you rightly pointed out, my name is Sbu Gumede. I am an optometrist by qualification. I have been in private practice for well over 25 years now in the Durban CBD along Pine Street. And that is where I have been practicing optometry. And over the years, I have built a rich network of other disciplines within the medical field, as well as other stakeholders in vision care. And thank you for inviting me to be a part of this discussion. And I hope I'll be making valuable input towards this topic.
Thank you, Sbu. Delicious.
Yeah, boy.
Yeah, please make my people know who you are and your interests, especially in this space.
I'd like to say thank you very much for your invite, and welcome all the viewers on all different platforms. And my name is Untitled Chapter. Those that know me, I'm in the space of broadcasting. To be specific, ENG News. I've been literally I've literally been employed by all the top news agencies in South Africa, and I'm currently freelancing for an international news agency. And I'm in the space. I'm in a space where the idea for me leaving my full-time job is to try and focus into my own wealth creation. That's what I call this part of my life. And I went into buses and just got myself 8 acres of land to do some cattle farming, pigs, and end. So that's where I am. And another part of my life is I'm a member and I represent the Albinism Society of South Africa. And yeah, that's where I am.
Lovely, lovely. From yesterday, just to bridge yesterday's discussion and today, what is one thing that you think we managed to get across to our viewers yesterday?
From last night after we finished, and obviously I got a whole lot of compliments, thanks to you, Doc. And all I can tell you, most of the people, I even got very strange calls that I never thought I could actually have a conversation with such a person.
Yeah.
Especially about this subject.
Yes.
And this is one that came into my mind was exactly what I literally said.
Yes.
The minute the so-called normal people realize that they've been hating their own,
yeah,
for me that would be, and when I had this conversation with this friend of mine, and she actually listened to the whole podcast and came and called me, and she said, I actually never thought, I've always thought, she's based in Joburg, she's always thought, the stigmas and all that people were carrying. She's been my friend. We've never had such a conversation up until last night.
Yes.
She actually said to me, she's grateful that she's a friend of mine, and she's grateful with all the information that she actually just consumed last night. And that for me was, if this made a difference to one person that I'm close, that I know personally, I am so glad. I am so glad. And this for me, it's going to give me more drive, more energy to actually say, exactly what I was saying to you when we were concluding yesterday, education. if we could go out there and people could be informed, I'll be one of the most happiest men.
Lovely,
And
lovely.
thanks to you, and thanks to you and your platform.
Lovely. Thank you, Udilicious. All right. I've just tried to get hold of Miss Matolweni. Unfortunately, she has just suffered load shedding where she stays. So she'll be joining us any moment now. We still have enough time to have her with us. So don't worry, but we will have to continue with the discussion. So Sbu, I think you're gonna start by just yesterday when we had the dermatologist here, she explained everything about the genetic, situation that has led, or that leads to people presenting with albinism, but it never hurts, when stuff is repeated. So I would want you just to give a quick background, about this condition called albinism. When we were talking earlier, you mentioned that, it's a metabolic condition relating to the production of melanin and all of that. I want you to start there, all right? But whilst you are doing that, I'm just going to switch off my camera for a few seconds because I need to just sort out something quickly, if you don't mind. All right. So I want you to just give a quick background to the listeners about this condition before we get to the challenges, the visual challenges that people normally present with. Is that okay?
Thank you, Pele. First of all, let's start by looking at the word itself before we go into the details of the beast. The word albinism, it comes from a Latin word called albus, and which basically means white. So it's only in 1908 that it was clinically defined as the abnormality in the pigmentation of the skin, the hair, and our eyes. And as you rightly pointed out, it is a group of hereditary disorders. It's not just one disorder. It's a group of hereditary disorders that involve the abnormality of melanin metabolism, referring to the synthesis or the distribution of melanin in these three tissues. Most of the time when people talk albinism, they often make a mistake of associating it mostly with the skin challenges, and perhaps rightly so, because the skin is the largest tissue in our body. But I will argue that the condition, it's more devastating in terms of their day-to-day life. It's more devastating on the eyes, and hence it is categorized as a disability because of the effect that it has on the eyes. I will try to unpack this impact, and as we pointed out, that it's hereditary, and it all has to do with melanin synthesis. Albinism can be broadly divided into two categories, which is called oculocutaneous albinism, and the second group is called ocular albinism. And again, let me attempt to unpack these words. Oculocutaneous, it means that albinism, it affects the eyes as well as the skin pigmentation. And ocular albinism, it limits itself most of the time to the pigmentation challenges in the eye. It has very minimal, if any, pigmentation expression on the skin. So oculocutaneous albinism, it affects. Am I still?
Yeah. You are still audible. Yes.
Okay. Thank you. And as we have rightly pointed out, that the primary morbidity of both the oculocutaneous albinism and ocular albinism is eye related. So what do we see as optometrists? You will remember, Bele, during your training that week of ophthalmology, that 1 week block of ophthalmology, the instrument that is used to look into the eye, the ophthalmoscope. So when we take the ophthalmoscope and we look at the fundus of a person living with albinism, the first thing that strikes you is hypopigmentation. This is very important, as we pointed out, that ocular albinism will only express itself most of the time in the eyes. So that'll be like your first time that you realize, okay, we've got hypopigmentation here. This is albinism. So sometimes that hypopigmentation, it's difficult to differentiate it from the hypopigmentation that we see in a child who has got a normal eye. So that's the first thing that you pick up, that hypopigmentation. What are the signs and symptoms of an eye with albinism? Number one, it's photophobia, refractive errors, monocular vision, strabismus, pendular nystagmus, iris transillumination defects, the foveal hypoplasia, abnormal decussation or crossing of the optic nerve fibers at the chiasma level, and the decreased hearing associated with some forms of X-linked ocular albinism. With all this range of signs and symptoms, it may call upon us to look further into what is this melanin deficiency and how is it brought about. And it helps sometimes to explain the different types of albinism. And I hope to touch on that a little bit later.
Yeah.
These ocular manifestations are almost always present in both forms of albinism. However, the degree of their presentation can vary depending on the type of albinism and the racial background of the patient. Interestingly enough, when you talk about the racial background, I was busy trying to prepare for this, and one of my patients walked in, and I told her what I was trying to prepare, and she was like asking, "Do white people really have albinism?" So yes, all racial groups, they have people that are living with this condition. And we have mentioned already that it's genetic. The background is more genetic, and so that inheritance pattern is variable as well. It's quite variable. Oculocutaneous albinism is mostly an autosomal recessive disorder, whereas ocular albinism is transmitted as a sex-linked or autosomal recessive disease. I don't know, Pele, whether you want me to go further and look at the pathophysiology of the condition and how all these signs and symptoms come about.
Well, you can go ahead. You can go ahead. I know you're talking at a higher level, but I think it's important for people to know, like you said, There is the one that needs two parents to have the gene so that they can have albinism, the autosomal recessive. And then there is the one that is X-linked, where, a mother usually is the carrier, and that presents, and that's normally the ocular one, not the one that, affects the skin and the eyes. So I got that. But if you want to share a little bit more, it won't hurt. I'll tell you if you are being too deep.
But it's very informative. I urge you to actually go further.
Yeah.
No, thank you for that encouragement, Odirili. Now, going deeper will make us understand the prognosis of the condition, and which is what this topic is all about. And I wish Ms. Matolweni was here because it touches on what one can expect in a working environment as the disease progresses and in the career path of a person living with this condition. So let's go back now to what this melanin issue is all about, and I will try to be as brief as possible and not confuse the audience. It's all about melanin metabolism, and melanin is the pigment that is responsible for the color of our skin, hair, and eyes. And what happens is that in the eyes, this melanin is critical in at least three structures, or in at least 3 parts of the eye. Number one, it's the iris, the posterior layer of the iris. It's a pigment epithelial layer. So if you remember, Bele, the iris is the one that controls the amount of light that enters the eye. So it's like a curtain. And what happens is that in patients with albinism, they've got transillumination of the iris, which means that that iris is no longer blocking the light. So that light, it makes its way through the iris, even though it's present. But because that pigment, which is the one that blocks that light, is not there, or there is a deficiency of that melanin or pigment. So the intensity of the light that reaches the back of the eye causes so much discomfort in these individuals with albinism, and results in a condition called photophobia. And that is critical as well when we look at the full spectrum of light, to understand that sometimes when people think about light, they think about visible light, and they forget about the invisible spectrum of light, which includes your UV light. And that UV light causes a lot of damage to the back of the eye, the long-term damage to the back of the eye. So that pigment, epithelium, the lack of it on the posterior layer of the iris, it means that the eye is not sufficiently protected against these harmful effects of these rays. So that's number one. And the second part of the eye, it's the retina, which is the inner lining of the back of the eye. And you will remember, Pele, that the retina is a direct extension of the brain. That's why when you pronounce a person clinically dead, you shine that light into the eye, to see if there is any activity in the brain, because that light will fall on the retina and then it will then trigger the further reactions to the eye. And if there is no reaction, it tell you that the brain or the retina is dead. So the retinal layer in turn has got 10 more layers. And one of those layers is the pigment epithelium. And again, there you come across melanin as a pigment, which is important in the structure of the eye. So these individuals will not have that melanin, and it will lead to complications that we will try and discuss further. And also when you look at their fovea is, we call it, it's got hypoplasia, which means that structurally there are problems with the fovea, which is like the center of your macular area. And instead of the normal eye having just one layer at the level, at the point of the fovea, which is the ganglion cell layer, it's only the ganglion cell layer of these 10 cells that are normally there in a normal eye. But in an eye with albinism, you find that you don't have that depression, but the other layers of the fovea, the other layers of the retina at the level of the fovea are present. And then when you go further down now, to the connections between the eye and our brain, which is the occipital cortex, where our visual function is controlled, there are complications along that visual tract, particularly at the level of the chiasma, which is the cross-linking of fibers from both eyes to the back of the brain, the visual cortex, and we will talk about that later. So that's how we come across some of these complications. And this melanin metabolism and defects, it lies within the cells that are called melanocytes. And in these cells, melanin is synthesized from an amino acid called tyrosine, which was mentioned yesterday by the dermatologist. So it is that conversion of tyrosine to dopa by an enzyme called tyrosinase. And this process, it takes place in small organelles or spatial organelles that are called melanocytes. And then these melanocytes are important in the different categories of albinism, because we look at, for example, the distribution of these melanocytes, as well as the concentration of melanin within these melanocytes. That's how these classifications are made, and that speaks to the prognosis of each of these types of albinism. I hope I'm still with you, Pele.
Yes, you are still with us. I was just trying to make sure that our other guest, Ms. Matolweni, is actually sorted. Remember, there was some ESCOM challenges, that actually came without her being prepared for them. So, but she has now joined us. And so let me introduce her, and then we are going to continue with the discussion. But you gave the necessary depth, to the discussion as far as the visual challenges are concerned, more at a pathophysiological level. And for the last 5 minutes, Ms. Matolweni has been listening and settling down. I'm now going to welcome her. All right. And then we'll be able to proceed, all four of us, and actually take this discussion to the level that I think it should get to. That will be beneficial for the people who are listening. All right, Ms. Matolweni, Mamdolo, good afternoon. Welcome to the Dr. Fundi channel. I've already introduced you in your absence.
Oh my goodness.
Yes, no, I just told people that you are a qualified occupational therapist.
Yes.
There's a wide range of occupational therapists. There are those who deal with school children. There are those who are in other places. There are those who are in the vocational space. And you are one of those in the vocational space. You are an expert on matters of incapacity and disability. You're one of the people who are very passionate about matters of disability in South Africa. And you work for Metropolitan Health Group as an expert on these areas. And so we've invited you as an expert, one of the few people in the country who are actually quite strong in the area. And so that's the background that I gave.
It's a very colorful background, Bele. Thank you very much. You actually took a very big risk in introducing me in my absence. But if this is all that you said, then you've hit the nail in the head. Indeed, everything that you've said is what I am and what I aspire to be. Thank you so much, Mhlekazi.
Yes, and I also obviously in introducing the topic of the day, I mentioned that today the focus is around the workplace or general functionality, you know, in terms of activities of daily living, you know. Our guest from Durban, Sbu, has done an excellent job in actually, you know, giving us the detailed information around what is wrong in the production of melanin and how that actually affects the iris of the eye and also the retina, which is the inner lining of the eye, which is an extension of the brain. Yes. All right. So he's done a perfect job in explaining that. All right. And Udi Reling has been sitting and writing, taking notes, you know, free lecture, you know, because we are supposed to empower each other with knowledge like that. So I am happy that there's value, you know, that he has derived so far. Now I'm bringing you in as an occupational therapist. Most people will not know that there is a role of an occupational therapist when it comes to people who have got albinism. So what I will want you to share with us is what is the role at a high level, before we go to detail, what is the role of an occupational therapist when it comes to people who are living with albinism, just at a high level, all right? And maybe touch on smaller things like impairment versus disability versus occupational disability versus handicap, you know, those kind of definitions. You see, my parents were teachers, so they always told me that when you are talking about any subject, it's important to define it first so that people know what you are talking about. Because you may think that people know what you're talking about, and you are on a tangent. So just start with those basic definitions. What is impairment? Right. What is disability? What is occupational disability? And what's the role of OTs in assisting people who are living with this condition?
All right. Thank you so much, Bele, and thank you for the intro. Good afternoon to my colleagues, Sbu, my brother, and Udiri Leng. Bele, when I walked in, apologies, I was a little bit late, issues of load shedding took the toll on me. But as I walked in, My colleague and brother, our optometrist, Mr. Gumede, was almost defining or properly defining the physiology or the mechanisms in the body that would then make a person with albinism not be able to see. And I'm just saying this in the simplest terms. So, and we refer to that as an impairment. So an impairment would then focus solely on the organ itself. So if there's a deficit in the organ, so we'll say there's a visual impairment because, as Sbu has nicely defined, what then would make us see the pathways. It could be neural, it could be in the eye itself, iris, or back in the nerve, the retina, or back in our visual centers in the cortex. So if there's anything that is wrong within the structure of the body itself, and in a way, it is not what you call an acute a disturbance, but then it takes time or it's been there for a while, we refer to that as an impairment. Now, impairments could be physical. So if I've got a lesion on a nerve, or if I break my leg and you are unable to fix it, I'm just using the simplest terms. It could be physical, it could be sensory. Sensory is the ability that we as people, we use to interpret our outside world. So it could be visual, it could be auditory, it could be tactile through the skin, and it could be mental or behavioral. So those are just impairments. So disturbances in the normal functionings of our body system. So if we want then to zoom it into our today's topic, albinism would then fall under what we call a sensory impairment, because then we're unable, there's a disturbance in the interpretation of what we see within our eyes. And the issue could be any other places that Mr. Gumede has mentioned, starting from the external structure of the eye to your cortex, the back part of your brain, where vision is interpreted. So it could be anywhere there. Now, because it is a sensory impairment, we use our senses to navigate within our external environment, right? So specifically in this conversation, let's look at the area of work. So I would need my intact vision in order for me to discharge my expected job duties. And therefore, if there's an interruption or if there's an issue with any of my senses, specifically a visual impairment, then an occupational therapist is then going to come in, because we need to understand the extent of the impairment and further on how then it will affect your ability to discharge your job duties. Now, you asked a very key question initially to say, what then would be a difference between an impairment and a disability? Now, an impairment would be a disturbance within the bodily organ or system, but a disability then would be, how does that impairment affect my ability to discharge my activities of daily living? So there's an element of interaction between an impairment and your environment and your expected roles as a human being, which then would result in whether an impairment would result into a disability. So other people would have impairments only, and that impairment would not necessarily become a disability, depending on the roles that they're at a particular time. I'll give you a personal example. I was born with six fingers in each hand, right? And they were cut off at birth, the sixth one, but I could then be having an impairment in that sense. But looking at my roles as an OT, as a clinician, as a consultant, as a manager at work, as a mother, as a friend, my impairment is not a disability, because now it does not affect my ability to exchange or to discharge any of my roles. So it is just a physical impairment. So it becoming a disability would then depend on the environment that I'm at. Is it enabling me to function or not? So issues of disabilities are environmental. And when I'm saying environment, Bele, the environment could be the physical, structural environment, or the social environment. So the social stigma and the attitudes of persons around me with my impairment could either enable or disable me.
Yes, lovely, lovely. So when we then say occupational disability,
Yes.
take it further now from the general disability to occupational disability. When would we say this person now has occupational disability as a result of any impairment? Obviously, today we're talking about albinism.
All right. Thank you, Mhlekazi. When we speak about an occupational disability, we need to then understand what you call the inherent functions or the essential functions of a job that a person is expected to discharge, right? I'll give you an example. I am a lawyer by profession. I'm just giving an example. And I've been hired by Dr. Fundile in his organization. So, and I get what you call a spinal cord injury. So I'm in a wheelchair, right? I come to work, I'm still on my wheelchair as a lawyer at Dr. Fundile Nyati's consulting, right? But my inherent functions as a lawyer is legal representation of Dr. Fundile in matters of litigation, right? My disability or my impairment is just a spinal cord lesion, okay? Now, if you're looking at my essential functions of a job and my disability, there is no interruption. So I do have a spinal cord impairment, but I'm still able to discharge my duties because the essential functions of being a lawyer at Dr. Fundile Nyati's consulting is legal representation. However, Dr. Nyati, if I get a head injury, right? A severe head injury for that matter, such that my cognitive, my mental, and my behavioral functions are impaired, right? As an attorney at Dr. Fundile, I am bound to have an occupational disability because the crux of my functions as a lawyer, so the crux of my legal representation would then require, the inherent functions would then require an intact cognitive, mental functioning in order for me to discharge my essential functions of being an attorney at Dr. Fundile Health Company. I'm not sure if I'm giving I'm trying to be giving the most understandable definitions.
Yes. No, yes. Udireleng, did you understand our friend Rethabile? No, you need to unmute yourself.
Back on?
Yeah, yes.
Yeah.
So
No,
the explanation about impairment versus disability versus occupational disability, because we're going to use these terms, you know, as we get further in our discussion. So it's important that we clear them out now so that we understand as we move. So are you with her explanations?
Fully with her. I'm fully with her.
Lovely. Prasbu, are you with her? You must unmute yourself as well.
Okay. Thank you, Pele. Yes, I appreciate the input that she has put on the platform.
Beautiful, beautiful. All right, now, you know, we have gone through the basics. Yes. I want us now to then say somebody who is born with albinism, they may have an impairment.
Yes.
As a result of albinism, of which Sbu is going to tell us, you know, largely visual, all right? Yes. Largely visual impairments on both the ocular or the oculocutaneous one. You know, and there are different grades, obviously. Others may have mild visual impairments. Others, the impairments may lead to a point where they are actually legally blind. It's a whole range of people. In some, they may have minor at the beginning, but through, you know, progression, you know, exposure to the UV rays and whatever that the Sbu has mentioned, it may progress to a point where their visual acuity is actually, worsened. All right. So at some point, one can say it becomes a disability. But at some point, there is impairment, but it's not necessarily a disability. Right. So today we want to look at the disability part of it, or the progression towards disability. But before we do that, because with the cutaneous or the skin lesions, yes, there's a risk of cancer and other skin problems, but they do not generally lead to any disability. All right. However, the impact on the eyes, and obviously the whole thing up until the interpretation of images in the occipital cortex, can be affected. Now, I want Sbu to then quickly take us through what are the common visual challenges that people who are living with disability normally present with. He has given us the pathophysiology. He has given us, a lot around, the genetic makeup, autosomal recessive, sex-linked gene, and all of that. We've got all of that. But now let's get back to the basics. What are the kind of visual impairments that a person with albinism can present with? Because once we have talked impairments, the next step is to then talk about the disabilities as a result of those impairments. What are those things that they can no longer be able to do as a result of impairment, which is disability in general? But if we're talking in the workplace, what are those functions that they were previously able to do, which as a result of the progression of the impairment, they can no longer be able to do? And that's where Ms. Matolweni will then come in and say, what obligations are there for the employer to assist, starting from recruitment, from an Employment Equity Act point of view, to issues around, Labor Relations Act and incapacity and disability, issues of, and other related acts. So I want us to flow like that. So can we get to the issue around the impairments, Mr. Gumede?
Thank you, Pele. Once you start talking about impairments, you are introducing now the measurement. So how do we measure the visual impairment? We use visual acuities. Yes. And what are visual acuities? Visual acuity is this is the standard of measurement that we use to measure how well a person sees. And maybe at this point, I need to introduce the two different types of measurements: the metric as well as the imperial. Because sometimes people, they hear about 6.6 visual acuity, which is the normal acuity, and they hear about 20/20 vision, this being a 20/20 year as well. And you talk about albinism, very relevant in September. Right. So normal visual acuity is 6.6. In South Africa, we use, so this is 6 meters. All it says is that this person will be able to see a letter that a normal person will be able to see at 6 meters. He is also able to see it at 6 meters. Yeah. And then
how big should that be? How big should the letter be as within that 6 meters?
Sorry?
I'm saying the font size of that letter, if you're saying it's supposed to be 6 meters, how big should the font size be for that particular, for an average person to actually see such a letter, to actually be able to read?
Okay. When we talk about visual acuities, we don't talk about the font size, but what we talk about, what you're trying to ask is, the measurement that we use to say how big should this letter be. We talk about 1 minute of arc at the layer of the receptors on the back of the retina. So that letter must be able to descend an angle of 1 minute of arc at the photoreceptors or receptors on the back of the eye, that is the retina.
As in, I need to be able to read that letter that's 6 meters away within a minute, if I just understand you properly.
No, it's an angle.
Oh.
Sometimes when you talk about an angle, we use minutes of arc, not just minutes of time as in hours, but as an 1 minute of arc.
Okay.
So that's how big that letter needs to be. So that's normal visual acuity. And most of the charts that we use, they go up to about 660, which is the biggest letter, and that would be like 2200. What that means is that a person with a 660 visual acuity has got very poor vision. That person, what it means is that that person will only be able to see that size of a letter at 6 meters
instead.
Whereas a normal person would have been able to descend that letter as far back as 60 meters. So that is how this 66 2020 notation comes about. And I hope I've made it clear. And
You've
then,
just,
so now
You can go to the 2021 whilst you are there. You said there are 2 types, so you've gone through the 66, and that was very good. Maybe let's also just go to the other one, the 2021.
The 2020 it's imperial versus metric. The 2020, they don't use meters as a measurement of the distance, but they use feet.
Yeah,
it's the same measurement. It's the same measurement of 6 meters, but now they are using feet as their measurement of the distance. So that 2020 vision is the same thing. That person will be able to descend a letter at 20 feet, and that letter should be able to be descended by a normal person at 20 feet. That's what it means. And at 24,
2200.
Sorry?
When it is 2200.
That's 660. That's equivalent to 6. So that person now will only be able to descend to see that letter at 20 feet, whereas a normal person would have already been able to descend it as far back as 200 feet. That's what it means.
Yeah.
So now, let's talk about impairments and disability, and introduce the topic of legally blind. What does that mean? So, like yesterday, Odile spoke about his impairment and not being able to get a driver's license.
Yes.
Right. Let's talk to that a little bit. And by the way, Odile, I hope we'll have time. There is a solution to that we can propose to the government, but we can shelve that for now. And
I've been made aware of such. I think I've been made aware of such by one eye doctor, and I just didn't follow it up that much because when I thought about it, as much as I do, I'm an illegal driver. Sorry to just put it into life, but what I mean is that tends to affect my reaction. So I just decide for my safety, it's better maybe to do it if I really have to, but just avoid.
Yeah, no, that's fine. We're gonna get to that discussion. It's a necessary discussion,
yes.
with you, but anyone else who is either living with albinism or has a family member who's living with albinism. It's basically what best practice is elsewhere in the world, and it's something that Mr. Gumede will touch on. All right.
So now let's talk about this, any deviation from the 6-6 visual acuity, which is normal. The reason why Relane cannot hold a driver's license is because he cannot meet the minimum requirements of at least one eye being better corrected to a 6-6 visual acuity. So his vision is impaired now. So that's why he cannot hold a driver's license.
Yeah.
Maybe in both eyes or one eye. And there are there are various categories as well of codes, which we're not going to get into. Now let's talk about disability now. In terms of the South African law, for you to get a disability grant, your best corrected visual acuity in one or both eyes is worse than 636. So that's when you qualify to get a grant. Your vision is worse than 636.
Let me interpret with my layman lingo now. So
I was about to.
Something that a person who is considered normal can see at 36 meters. You know, when even at 6 meters,
it doesn't necessarily have to be.
You are
it doesn't necessarily have to be an alpha. I'm saying it doesn't necessarily have to be an alphabet.
Yeah.
Can you hear me?
Yeah. Yes.
Okay.
Yes.
I'm saying it doesn't necessarily have to be an alphabet. Let's say we talk about a structure.
That's fine. He's going to explain those things.
Am I still there?
Yeah. Yeah. He is going to explain.
All right.
Yeah. Just relax. He's going to explain that. But I was just trying to make people understand. He said, for one to get a grant, your vision must be worse than 636. So I wanted people to understand what 636 is. All right. Then he's still going to go further and explain. But I just thought I needed to bridge that gap for some of us who are slow learners, you see. Yeah.
Yeah.
Okay, then that's legal. That's the definition of legally blind. You can see, but your visual performance is so poor that it will hinder you in your day-to-day life to earn a living with the best possible correction.
Yeah.
Once all the means of correction have been exhausted. And it's not only about visual acuity as well. It also introduces the visual field. How wide can you see? Peripherally. For example, let me give you an example for those for the members of the audience. For example, a visual field, if a person has got a limited visual field and the person is walking through a door, because of his limited visual field, he may not see both limits of the frame of the door. And you will find that person bumping one of the shoulders on a frame because he is not aware that, okay, now there is a frame. His visual field has got tunnel vision, for example.
Yes.
Those are the definitions of disabilities. And then now you've got somebody who's got no light perception at all, who cannot even see a light if you shine it in front of their eyes. So those are the extremities that you are looking at when you measure the visual limitations in terms of a performance of an individual.
Beautiful. Beautiful. Yes. Do you want to go further, Mr. Gumede, or I should move to Ms. Matolweni now? now that we have set that ground, I can see her. She's itching. She's itching to share. You know, the OT in her. You know,
No.
just wants to make the pots. You know.
Happen.
All right, Matolweni.
No, I was actually agreeing with a lot of the things that I don't want to call him Mr. Gumede. I'm not sure if he had disclosed the relationships within this forum. This is my brother, ladies and gentlemen. So it's very difficult to refer to him by anything else except Sbu or Kwade or Yeye. But for the sake of this forum, I will stick to Sbu. I was agreeing with a lot of things, in fact, with everything that Sbu was saying. And he said something very critical to say, what is the determinant when a person now with a visual impairment would want to apply for a disability grant? And if you said we must touch on the legislative framework now that is actually managing or regulating the employment of persons with disabilities. And we've got the Employment Equity Act 55 of 1998.
Yes.
And in that document, in that act, there is a nice document called the Code of Good Practice into the employment of persons with disabilities. Now, it is in the Code of Good Practice that you will find the definition of what constitutes a disability. And that code moves further then to mention what we call the exclusion and the inclusion criteria. So what is excluded? So even superficially, even though a disability can be described as a long-term or a recurring physical, sensory, or a mental impairment, which now we're talking about work, Bele, get me now, which limits your chances into entry into employment or advancement into employment if you're already there. Right?
Substantially limits.
Yes, substantially limits. Yes. Either your entry or your advancement to employment now, because now you either have any of these impairments that you have described. Now, it will then give us what is excluded. So it will say, for instance, something like, even though I may have a tattoo is long-term, a tattoo is unlikely to go away, but it doesn't fit into this description. Now it comes to now the issue of the wearing of glasses, right? So it does not mean that every person who wears glasses is considered as a person with a disability, but it says that if you're wearing your glasses and your vision is still so impaired that you may need external assistive devices in order for you to be able to carry on your job duties, then you've got a disability. And you've got a visual impairment according to the Employment Equity Act now. So you'll find that 99.999%, and if we round it off, it would be 100% of persons with albinism would then fit into this definition of them legally being regarded as persons with a disability, at least within the work context, right? Now, the issues of the extent and the nature of the disabilities and how then it unfolds within the work context, I'm not sure if I could delve into them now, then is another, okay. So if a person with albinism is seeking employment, right? Number one, they would then, and I'm using this term loosely, enjoy the classification of then being persons with disabilities because they tick that box. And I will tell you that it was quite a struggle for us or for the society, for the sector, to be able then to have won that battle to say that actually persons with albinism actually fit the criteria as set out by the Act, because I think lawmakers and employers were very biased to persons with mobility disabilities, people who are on wheelchairs and people who are using crutches. So it was very difficult for them to understand, but how does a person with albinism then fit? Until then certain, experts like ourselves then came in to give input to say that, look at the definition, and we dissected the definition versus the pathophysiology of albinism, more specifically around the visual impairment. So a person would then be classified. Now, law says once a person discloses of their disability, the employer has a duty to reasonably accommodate for that person. Now, what is currently happening is not what we ideally want to happen, like persons like myself. Because what happens is this: we have a legal system or a regulatory system which sets certain targets for the employment of persons with disabilities. And those targets are linked with certain incentives, right? So you've got a percentage of persons with disabilities, your BE points improve if you want to do business with the state. Or even as a state entity, you've got a person with a disability, so you meet the points, which means that then you're compliant. Other people actually get incentives when it's time to incentivize them over the years or during their period of employment. So what happens is this: you get a person with a disability, they apply for the job, they disclose of their disability, we put them in a job because we want the 2%, we meet the target, it doesn't matter where we put them because they've got a disability, and we're fine. And unfortunately, that's where the law ends, to say that a person discloses, you meet the target, you are okay. So what happens in their ability to discharge their duties then becomes something else.
All right. I just want to touch on that part, Mamdolo. So there is an obligation on the person to disclose, right,
Yes.
to the employer.
Yes.
But sometimes it can be evident,
Yes.
you know, that this person has this disability, in which
Yes.
case the person need not disclose because it's self-evident. Am I right?
No,
Okay.
you're not right.
Correct.
Sorry.
Correct me.
No. All disabilities, whether they are evident, whether they are not evident, must be disclosed according to law.
Okay.
Because then, yes, right? And the second part is the issue of reasonable accommodation.
Agreed.
Because how then are you going to assume what type of reasonable accommodation do I need if I did not disclose? And secondly, there is no umbrella one size fits all in disabilities, because sometimes you find that then, because I was born with a particular impairment, I have a very supportive family structure. I'm from a place where there is resources. And so I've learned to navigate around my impairment, versus I myself now at 40 plus 1 years old, I sustain a disability and I'm still in shock. There's psycho-emotive issues around me, around my disability, and maybe I even have pre-existing medical conditions which actually also contribute in my functional capacity, and it could be the same sort of an impairment, but because it's happening at two different people with two different stages in their lives, then their functional capacity will be totally different. Hence, you can, you know, Bella, I always get this request that Rethabile, give us a list of disabilities. And I'm like, such a list does not exist, because it depends on the functional capacity of a person versus the impairment that they've got. So, so that element of disclosure becomes very critical, because it is in that process that you learn to understand what does this person need in order for them to discharge their duties. And if you come to issues of visual impairments, because they have different categories or different ranges, Sbu and you have all actually even explained earlier on, in terms of severity of the visual impairment, then you will then need someone to come in and say, let's determine what we call your functional capacity. Let us see how, and determining a functional capacity would then be taking a report from my brother Sbu, and would be also be me taking a report from your HR to look at the inherent functions of your job and do a match to say that this job requires so much visual acuity, this job requires so much of visual perception. So there's visual acuity, there's visual perception. I'm sure Sbu has described those. And this is what Sbu report says. And therefore, this person will require this type of irreasonable accommodation. Does it make sense? So that exercise becomes very critical when we're employing a person with a disability. It could be a visual impairment or any other, but because I was saying we are almost chasing targets, we miss that process, and we end up placing persons in environments where they may develop what I refer to as secondary disabilities, because now the environment we've placed them actually exacerbate or worsen their conditions, because someone like myself did not come and get the report from either Sbu or an ophthalmologist and actually match that with the inherent job demands, so that then we place people in the safest and the most comfortable working spaces.
All right. Now, I want to ask you a question there, Mamtol. So, a person with albinism, with, visual impairment, comes in responding to a job advert, right?
Yes. Yes.
Now, my understanding is that, the employer should proactively, deal with that matter at that point. In fact, the law even extends to people even before they are employed.
In the recruitment
from employment
space.
equity point of view. Now, we have a situation in South Africa where people with albinism who may have visual impairments do not get employed, all right? They are discriminated against even before they get employment, all right? And even when they come for interviews, they get sometimes situations where, if they are lucky, they get placed wrongly, like you've said, without the necessary evaluation with the assistance of somebody like you. And therefore, they end up being put in routine jobs that don't challenge them, that are not linked to their skill set, and therefore they don't progress, and they sometimes get overlooked for opportunities within organizations. I want us to talk around that. Mr. Odireleng, do you have any not specific experience as an individual, but as a community of people who are living with albinism? Are you guys happy with the way employers are actually handling people who are living with albinism, from a recruitment to placement to promotion within workplaces?
I would love to actually I would like to actually go back to what Moses was saying. Most of the companies, I mean, I love this now, that this is a space where I feel like, probably I've been well exposed to within the sector that I find myself in. She is 100% correct. Half of the time, it pushes it. You get an organization that's, it's most about numbers. That's it. Bring in somebody, boom, leave him there. That's it. You're happy with your numbers. So now that is one of the issues that we're actually trying to have. Like right now, we've got a case that's been reported where one guy, it's not even meant to be under public scrutiny. One guy, he works for this big organization, and he decided to go for an IOP, and the company said, no, listen, sorry, we can't accommodate you on this. We don't have any, our company doesn't have any policy against somebody who's just going to go and try and fix his eyes. And he was literally told to go. And the case is actually at the labor court as we speak. So in true essence, that is one of the most issues that we're actually trying to remedy.
If I may come here.
Okay, come in, Sbu.
Yes.
Okay. I really appreciate what Matolweni has brought forward. But I would like to take you guys a step further.
Yeah.
And at times it's devastating for me to witness some of these things that are happening. You introduced yesterday how the government introduced the bill to try and the white paper to assist the people living with disability and albinism.
Yes, that was 2015.
Yes,
Yes,
in 2015.
but no date.
Right. So, and our tertiary institute, let's go back to training before we even talk about
primary education.
Sorry, let's go back to training. Let's start there. It's very devastating for me, some of the things that I've witnessed. You find that the tertiary institutions have heeded that call to accommodate, to reasonably accommodate, let me say that, people living with albinism as a disability. And they admit them in their institutions. To an extent that I have written a letter to the president of the South African Association of Senior Student Affairs professionals to say that in these selection committees, there is not proper awareness of the challenges that this panel is discussing. You find that a tertiary institution refers to me, a third-year student, in his final year of training. And that student now has got vision problems. And then when you start looking at the job description for what he is training for, you are immediately aware that the minimum visual requirements for that job description, this patient is not going to meet those requirements. And now this student has spent 3 years at varsity. This student, the parents back home, they are coming from the poor of the poorest. They have sold their last cow in the kraal to just help this child finish this career path and then come back home and pull them out of the poverty cycle. And now when you suddenly realize that this child is completely misplaced, it doesn't only happen at the level of senior students. It also happens at the level of pre-employment medical examination. You find that HR now is referring this student who is here to do the practical part of his training so that he can get that certificate to say that I'm a qualified engineer, for example. And now during pre-employment examination, the occupational nurse or occupational doctor picks up that there are visual limitations here. And only then, after the expectations, both from the child or student, as well as the parents and the community,
has been created,
going to come back and contribute to the well-being of his family and community, and only to find that he has reached the top rung of the ladder, only to find that it's leaning against the wrong wall.
Yeah.
And sorry, Bella, if I may interject.
Yeah. Yes, you can come in, Mamdol.
If I may interject, unfortunately, right, then this is where now the law comes in terms of then what is reasonable accommodation. And I think reasonable accommodation was meant to protect both the employee with a disability and the interest of the employer, because an employer would then require a productive workforce, especially that they are compensating for the hours that the person is working. Now, it then would say that, adding to what Sbu is saying, that a person goes through the entire training only to find out at the end that whatever skill set that they're training for, their disability, the inherent functions of that job would then this person is not going to be able to discharge them because of these visual problems that we are raising. Now, law then says you then cannot reasonably accommodate an aspect of the job if the essential functions of that job are affected. Do you understand? So back to my lawyer example. So if I have a head injury and I'm a legal representative of a company, my mental and my cognitive skills need to be intact. And therefore, you cannot bring that person to myself as an occupational therapist to say, how would you assist them to alternatively discharge their job duties? Because their inherent jobs is around the affected mental functions, right? However, but then you refer to this person back to me and says, Rethabile, this person is on a wheelchair. They are a lawyer, right? Assist them with mobility issues, assist them with ABCD, assist them with restructuring their office space for that matter, assist them with assistive devices, the artificial ramps and everything else. Then law allows me. Then law actually compels the employer to then contribute towards any assistive devices, because the inherent functions of the job are not affected or are not affected by the nature of the impairment which has been sustained. So Sbu is raising a very important issue that someone would follow a career path and then you realize that the inherent component of this career path is so much visual acuity that then even if you put them in that job as myself, you would actually cause what you call secondary disabilities. You would actually entrench a stereotype which says that persons with disabilities cannot perform as compared to their counterparts without disabilities. So even when you bring reasonable accommodation, there's going to be an issue with the performance of the key crux requirements of that particular job, because the training was then not meshed with the disability itself. And I think this is where now you find now it is ourselves, there's persons with disabilities this side, there is HR this side and employers, and you need then people like us to say, what does the law say? What is this person's functional capacity? Because the entire purpose of reasonable accommodation is, if you can't totally remove the impact or the barrier of a disability, you can then minimize it such that my counterpart without a disability on the same position would discharge their same job duties with the same pace, with the same acuity, with the same attention to detail, because your reasonable accommodation is so in point that you've actually minimized the effects of a disability. So Sbu is raising a very important dynamic to say that, do we understand our disabilities? Because then it affects then later on how then we're expected to discharge our job duties.
How I'm seeing this is that, Sbu, we were talking workplace and you brought the issue of HR, right? At employment, right? And then Sbu said, let's go a little bit backwards. Before the person even is considered for work, to the people who are admitting these students for the various programs that they are being trained for, understand, that there are certain jobs or professions that may, even if the person has got the brain, they can pass. But let's say the person was going to be trained as a pilot, right? And the person with the visual acuity challenges from albinism will certainly not be able to pass the industry norm for visual acuity for a pilot, right? Right. But then there's even another step even before to say, as they're going through primary and senior and secondary, are the people in the schools aware, because not everybody goes the academic route, where it's grade 12 and then university. Other people, they branch at technical college or whatever level, you know, they've got a different name now, this thing of being old.
Vocational centers.
Yeah, vocational centers or FET colleges, you know. So actually, we are almost going back to say there needs to be a clear process at different stages, from primary, you know, from what they call it, before they go to primary. What do they call that?
Early childhood
Early
development centers.
childhood.
From early childhood development centers, you know, to primary, to secondary, to tertiary, all the way, and come in Sbu.
Pele, that's exactly what I was trying to speak to. Education and training. It starts from there. We need to speak to our government on these sensitive issues and these institutions to say that there is a white paper, there are guidelines, reasonable accommodation, there are professionals who should be sitting in some of these selection committees to help you, as well as sending a child to early childhood development institution. That first admission in a classroom environment, our government needs to be proactive. In other countries, a child, whether with a disability or no disability, is not allowed to enroll in a class environment until that child has been to an optometrist to check if that child, it starts from there, if that child will be able to follow the instruction in the class. So all these institutions, as well as the government, needs to start meeting all these people that are living with the disability. And you have people like Odireleng, to be honest enough on this platform to admit that he illegally drives. And he's not the only one, I can tell you. There is a lot of them. Why the government does not close that gap? Odireleng, some of the governments in other countries that are much more progressive, they have reasonably accommodated people living with your challenge to go to finer details of issuing a license to somebody like you. To say, for example, you cannot drive for more than 5-kilometer radius from your place of residence. You cannot drive, for example, at night. You cannot exceed a speed limit of 40 kilometers per hour. You cannot enter a freeway. Do you understand? You can be reasonably accommodated.
Yeah.
So it's not only the institutions, even the government needs to come to the party to reasonably accommodate some of these disabilities.
I agree.
Fully agree with you. Fully agree with you.
Yes. All right.
And maybe it's the challenge to you, Odireleng, as a member of the Association of People Living with Albinism. If you do not organize yourselves to say that we have professionals that can guide us in making these changes, you have to gather all these groups of people in the eye care profession, lawyers, people living with the disability, occupational therapists, doctors, to just come and assist you and lobby the government to say that we should not be a burden to the fiscus. You paying us a disability grant. Some of us are willing enough to say that as much as I have this disability, I am prepared to shelve the disability and try and live out of the sweat of my brow and a living and be independent. And instead of being a burden, I will contribute to the fiscus. So these are some of the things that, as people living with albinism, you guys need to change, and there's help.
Very true.
Yes. Yeah, Mamdol.
Thank you for the Sbu. Sbu is raising a very important issue to say that we need to look beyond the disability. So having said everything else, that we need to understand that then the laws of the land protect persons with disabilities, but someone needs to enforce them, and someone needs to monitor the enforcement of these laws, right? It could be the sector itself, it could be persons like ourselves, Sbu. So if the sector, so I almost think that some of these issues can never be left to the sector alone to deal with them, because it's not an albinism sector, it's a societal problem. So if all of us then, so if it is not a sector, it should be ourselves to say that, hang on, right? I mean, I have that sharp of an eye. If I go into a government building and I see someone with a disability, could be someone in albinism, and the worst thing that happens is that they would then be placed in the lowest grades of the jobs because want to tick that 2%. So you see a person, they're in a call center, and when you interact with them, right, they'll be like, oh, mdanam, especially in the hospitals that one used to work in, right? So you find that then this person has been a switchboard operator for the past 20, 30 years, right? And they think that they're being done a favor by being employed. So there is no plan to progress them from being, so people come, they come in higher positions, others, they train them, those that they've trained, they get promoted, and so on and so forth. And guess what? That hospital will be compliant because they've got someone who has got a disability in their switchboard. Does it make sense? So, and then you look at the environment of the switchboard and you're like, my goodness, this should have been placed there, this, that, the lighting, the this, the that, where's the magnifier? I mean, there's software now, all of those things. So, but someone like myself, I witness that, I go straight and ask, who's HR in this building, right? Mr. So-and-so cannot be working under these conditions with their disability because they're going to create more problems. Get ABCD, buy it. Law allows you to do that. And it then becomes the property of the institution. So they cannot take it at home, so that then if Mr. So-and-so wants to move to another entity, right, they can still employ someone with a visual impairment because they've got the JAWS software installed in their computers. They've got a specialized printer already. So the ownership of these devices actually don't live with persons with disabilities. They are owned by the entities themselves. Bele, I think now I'm taking over your job because I'm facilitating. Come in, Bele.
What I wanted to ask, because I've actually been thinking about this one. Somebody comes in,
yes,
gets employed, not the usual, entry jobs or frontline jobs that they like to put people with albinism in.
Yes.
Decent, mid-level management job, right?
Yes, sir.
But maybe this person does not take care of his eyes properly,
Yes.
and so the visual challenge worsens. Okay. And it then gets to a point where he or she is struggling to meet the obligations, or the inherent requirements of their job, right? Now, there's an obligation on the employer to reasonably accommodate that person, right? Now, the issue about assistive devices, reskilling, retraining on things like braille, if they get now to be blind, there is an obligation on that employer, as part of the acts, on employment equity and then others. So I want you, Mamtolo, to talk to us about that obligation on the employer to actually take it further to a point of saying, because the letter from Sbu, you know, is now really showing that it's getting to legal blindness.
Okay.
So we need to reskill at the cost of the company. Reskill, alternative place where there's a need, or even procure, procure assistive devices so that this person can continue to be economically productive as one of our employees.
All right. If Mr. X, if Mr. Nyati, I like giving people names. I love analogies, right?
Yeah.
If Mr. Nyati comes into the organization, Mr. Nyati is in the middle management level. Mr. Nyati has got albinism. Mr. Nyati has disclosed, even before there's issues of the condition progressing, right? Yeah. Mr. Nyati would be reasonably accommodated in terms of that component. Now I'm presenting the ideal say.
Yeah.
Someone like me would then have to come in, do what we call a functional capacity evaluation, and I'll then advise to say that this is the best environment, and considering Mr. Nyati's level of education, and this is the type of software or assistive devices that you can procure for Mr. Nyati to be able to work properly. So that happens. Mr. Nyati continues working and everything is fine. However, because we're advancing in age, and because we can develop other medical conditions, or because we're not taking care of ourselves, the condition may worsen, right? It may worsen with age. I mean, I'm not wearing glasses today, but I can see that I'm almost getting there because now my age is kicking in, right? Exactly. So there's a lot of issues that kick in. And you must remember, I'm not sure if this was explained earlier on when we're speaking about the pathophysiology around albinism, that sometimes when it comes to visual issues, it becomes progressive. So which means that then it worsens, regardless of the fact that I may have been taking care of my eyes or not, right? Now it worsens. The moment it worsens, Mr. Nyati goes to Sbu. Sbu reassesses. Sbu gives me a report to say that this is where now the health, and I'm trying to put it as simple as possible, this is where now the eye health is seated at, right? Now, another evaluation needs to happen because now the condition is progressive. So if Mr. Nyati was initially seen by a clever OT, part of the conclusion in the report would be, please note, this is a progressive condition. So functional capacity at this stage is based on the presenting clinical picture that I'm seeing today. However, if it worsens, we then need to come back in and do an assessment. So you do that, you conduct that assessment, say, and then I look at the inherent job functions, and we see that worst case scenario, okay, let's start with the good news. Good news is actually we're just using an external magnifier. Let's get a much more sophisticated software, which is JAWS software or whatever software. And then we see that functional capacity improves. Then you still continue because then we would have upgraded on the type of assistance, right? So it's no longer just the glasses now. There's something external, but you can still discharge on your job duties. Second possibility is that I look at the inherent functions of the job, I look at the report from Sbu, and there is no ways, right? I myself as a clinician, that there is no ways that this person or Mr. Nyati is going to be able to go back, even with the assistance of whatever software. They can't do job A within this organization. However, they can do job B, right? So which means that then you then write a report to say that, unfortunately, with all the assistive devices and the severity and the nature of the impairment, the inherent functions of this particular job, it's not going to, I mean, you're not going to get any work done. However, Mr. Nyati can still do A, B, C, D within the organization. The law still protects Mr. Nyati, but Mr. Nyati needs to be moved to that job, to another job where the inherent job functions are not then being interrupted by the impairment. Worst case scenario, what we then refer to as a permanent incapacity, and I'm sure you're also familiar with the policy and procedure on ill health, and yes. Then after the employee, we conduct an assessment again, and we look at the industry that Mr. Nyati is employed. We then make a determination: job A, it's not going to work. Job B, it's not going to work, and C and D. And in fact, there is no job within the organization that Mr. Nyati is going to be able to perform, because now the condition has progressed or worsened to such an extent that placing them in any other environment would start then creating health and safety issues on the employer, on Mr. Nyati himself, or on their colleagues, or on his colleagues. So now there's health and safety considerations which needs to come into play. And then you make that determination. That's when now you call HR, you call Mr. Nyati, you collect a very strong report supported by the medical findings, tests and everything else. And then you start a conversation around being retired on the grounds of permanent incapacity, or if it's a medical condition, or an ill health. And on that level, the employer would have demonstrated that they have exhausted everything in their disposal into trying to accommodate. However, this person remaining in the job itself would start having serious implications on their health and on their safety. So, and looking at all the jobs that are possible within this environment, it is just not possible. Then you start with that route. And that is the route that then you involve organized labor, that then you involve HR, the employee himself, and then obviously the managers. But there should be demonstration that all processes were followed and every route has been exhausted in order to accommodate the employee in any other alternative positions. But normally it doesn't happen like that. I mean, Mr. Nyati fails to do job A and then they're kicked out without then all of these things that I've explained being exhausted, without these processes being exhausted. So this is how things should be happening. Then it becomes an unfair dismissal. And that is why I say someone like myself needs to be extremely objective when they're writing these reports, because then you can be taken to SSMA. Then another independent therapist can write their own report to say, but I believe that this person can do A, B, C, D. So you must always be seen to be objective, and you must always be seen to be working on the best interest of the employee. Well, sometimes, not often, you get into an organization, I get called into organizations to come and intervene, and then you find that then they want to use the incapacity and the disability route to lay off staff members, right? Or to restructure the organization. That's when the element of objectivity becomes very critical, because then you need to be an objective clinician to say that even my colleague in China would have come to the same conclusion, given the nature of the job and the collateral medical information. So the issue of objectivity becomes paramount, so that then you try and deal with all these other shenanigans that are sometimes used by the employers to actually want to get rid of some of their employees. So they'll say, but the OT says you can't work, right? So you need to be, objectivity becomes very paramount, say, in this process.
Thank you. Yeah, now we're gonna need to start wrapping up. So I'm gonna ask Sbu for your, closing words, or words of wisdom around this topic, obviously from your professional point of view. And I'll do the same with Otirileng, and then Mamtolo, you will then wrap up. We have just about 15 minutes to 6 o'clock. So Sbu, about 3 minutes wrap up. Otirileng, the same. Mamtolo, the same.
Thank Thank you, Pele, for this platform. And just to wrap up, I would like to address Odireleng. Odireleng is a society of people living with albinism. You have a lot of work to do. Some of the topics have been covered here, but because of time constraints, we have not been able to cover some of them. For example, Matolweni has introduced a lot of stakeholders. One of the stakeholders that I feel is important is from the subjective point of view, what you as individuals living with albinism, you are subjected to. So be it at the workplace level, be it at the level of training. So at the level of employment, fellow employees you guys need to create awareness in all the members of the community to say that there is albinism, these are the kind of challenges, and restore your dignity as individuals and as people that are gonna add value to the organization or the company. And you earn the respect of fellow employees as well. There is no, because as it was introduced here, the various levels of management, you find that people living with albinism have got a challenge to make it up the different levels of management, because their fellow employees don't treat them with the respect and dignity that they deserve, and particularly in front of the subordinates of a manager living with albinism. So you guys need to create a lot of awareness using these platforms and using professionals to put momentum behind your efforts. And thank you.
Thank you, Brother Sbu. Odireleng, ke nako ya hao ntate.
Thank you very much. Thank you, everybody, for the opportunity. And this was a very insightful session today, I must say. And I must, to Sbu, I want to just fully agree with you to say we've got a whole lot of work ahead of us. There is tons and tons of work that still needs to be done. It's still like President Arna Chile, Sendelensel. So, but I still want to add on something. As ASA, educating. It's top there. It's one of our priorities. So, yeah. all the points that have been pointed out today, they fall into what we're trying to achieve as well. I've touched this yesterday when we were talking about the policy. We working very hard. Unfortunately, we are working in an environment I wouldn't say in a difficult environment, but it's not really that easy. But when I sit back and I hear there's people like you, people like the lady we're with yesterday, and the conversation that I had with a friend that we never even had that conversation, I feel like, you know what? It needs people like us that say, you know what? I have these people. It is possible. We will go forward. We're going to make it. And I'm saying, somehow, when I sat here and I'm sitting here, next 12 months down the line today, 12 months down the line from today, I still want to add challenge it, dog. I want us to spend this weekend, like the way we had this weekend. I would urge you to actually have this weekend again, 12 months time. And I promise you, there's going to be so much that we're going to still say, this work has been done. This has been done. There was this. That's yes. So thank you very much for the platform, and available anytime for you.
Thank you. I am making a public promise that next year, during my birth month of September, I will still champion the issues of albinism, because for me, it's one area that has been neglected for quite some time. It's an area where there's so much gross misinformation, myths, misunderstanding, lack of knowledge, ignorance, you name it. And I will continue to do that. But it's not only during September. If you guys feel there needs to be some webinar that can be done, you know, I will make it available. It doesn't need to be broadcast to other people, you know, or if you want it to broadcast, I can make it available. I mean, so the point is, for me, the discussion must not just end now.
Nope.
You know, we need to find other ways of advancing the interests of people who are living with albinism, so that they can realize their potential, you know, that God had designed for them, and not have man-made, you know, barriers that can actually be addressed with, you know, getting the right professionals to come up with solutions. So that's my commitment to you. All right. Mamtolo,
Just to add on to
you came in late, and I understand it was because of you know, load shedding.
Yes.
I'm gonna give you 5 minutes to wrap up.
All right. Thank you, Dr. Nyati, for this opportunity. I hardly call you Dr. Nyati. Thank you, Dr. Nyati. Thank you to my brother, Sbu. Thank you to Udirileng. For me, I'm actually very motivated by sessions such as these, because we try in our small corners to advocate for the employment of persons with disabilities, and specifically persons with albinism. And the reason why we are so passionate about these things is the fact that we understand that we can minimize or reduce the barriers that can actually affect a person with disabilities with them performing at work. So there is tangible interventions that are there. So it's just a matter of organizations, the disability sector itself, to reach out and say, are you able to assist us? And one cannot be everywhere, because the mandate is huge, and ours is a very scarce skill. But however, platforms such as these, Udireleng, affording us a chance to say, we are there. We may not be physically there. We can be an email away to say, I'm having an issue, or there's a member in a certain place who is being taken out of work because of ABCD, and we're there to advise, we're there to educate. And Belle, I've learned that the ignorance around the manifestation of disability within the workplace has got nothing to do with the level of education or the level of anything else for that matter. So you'll get a very JSE listed organization not understanding certain simple issues around certain disabilities. And you can get a public entity, I mean the public sector, they are the custodians of these acts and laws, and they're still not compliant. So what we're trying to say is that we are there to assist in all levels, so that then persons with disabilities are mainstreamed and they are actually included within the work environment, and all barriers or anything else for that matter is addressed, so that then they live dignified lives, they live productive lives, and they are able to contribute to the economy, and Sbu says they don't become a fiscal burden when they're able, when they can actually contribute positively with the assistance of persons such as ourselves as professionals seated in this forum. So ndiyabulela Belle, ndiyabulela.
No, not so fast, not so fast, Mamtolo. Not so fast. There
Okay.
is.
No, it's very true.
Wait, Udireleng.
Okay,
Sorry.
the hands are up now.
Mahanyan.
Udireleng also. Okay.
Mahanyan, Udireleng, Mahanyan.
Yes. Okay.
Mamtolo.
Yes, sir.
I'm going to talk now about the biggest employer in the land, which is the
Yes.
public service.
Yes.
They have a policy
Mhm.
on assistive devices
Yes.
for people with disabilities. But
That's
my
true.
experience is that very few people at HR
Yes.
or within the departments understand that actually there is that policy which gives them clear guidelines, including what they can pay for and what they may not pay for, what's reasonable and what's not reasonable.
What is not reasonable.
In consultation with people like you, all right, occupational therapists, all right. So I wanted you to just touch on that as part of your closing. I don't want you to give the detail, you know. I don't want you to, just high level, just creating awareness of the fact that there is that policy.
Okay. The policy is there, and a lot of other policies are there, because this policy is not read in isolation. So you'll have to look also at the legal policy, the health and safety policy, and everything else. The legal framework, right, is there to protect the employer of a persons with disabilities and the employee with disabilities. But the issue is awareness, because disability is still seen as are seen as charitable exercises. In other organizations, they're seen as, what's this word? Social, what programs, right? So nice social responsibility programs, and they are not seen as processes that could actually would help improve the bottom line of an organization. Hence now they are just shelved and put there. The issue is not the legal framework. The issue is the implementation of the legal framework, so that then organizations don't lose critical skills, right? So awareness around how do we implement these policies, right? It should be robust. Hence, I am very grateful that you have afforded us this platform. When it comes to regulations and laws and acts, we're not shilling for it. Even the fact that the National Disability Policy is still at white paper level and is not really an act. All these other acts, South Africa is a signatory to the United Nations Conventions of Persons with Disabilities. It also gives guidelines. So we've got enough legal instrument to move the process forward. It's the political will, and it's the awareness, and it's the attitudes around employers to say, shifting a mindset of this being a charitable act into this being retaining critical skills, which are sitting with people who don't process informations like the rest of us, and to saying, how do we untap that skill assisted by this legal framework? So this is what is needed, Mhlekazi, from my side.
Diabule, Udi had a question. Yeah.
No, it was actually it was just she actually just touched the part which I'm actually now more clear at. It was just a question posed to Osisi on Osisi. So she actually just touched it now in a concluding remarks.
Thank you very much. All right, guys. I hope our viewers we have stretched their attention span. It's almost 2 hours since we started talking, but some issues like this one, it's worth having a deep discussion like this one. We've had it over 2 days because it's that important. It's important. People who are living with albinism or people who are living with disability in general, they are not subhuman people. They have to also be taken into account, when we are planning, making our strategic plans in our organizations, looking at how to get the best, out of our employees within the companies that we lead. The whole issue of diversity and inclusion, it must not just be a lip service. It must be something that is practiced. So I hope the discussions that we've had over the past 2 days, especially today, will actually get the people who are influencers or decision makers within organizations, but not only within organizations as in employers, but also within institutions of learning, starting from lower down all the way to tertiary institutions, to ensure that during the time of career guidance, from secondary level into tertiary, people who are informed are able to assist with guidance so that the kids do not find themselves in a cul-de-sac once they have qualified with whatever engineering or any other course that they're going to do, only because they will not be able to meet the inherent requirements of the job. So we can never be able to finish this discussion, in 1 day or even 2 days, but at least this is a start. So I want to thank everybody who joined us, to listen to this discussion. And I want to thank you guys as my guest. You make me look good. You brought your A game. Hey, Sbu. No. You brought your A game, chap. Mamtolo, as always, whenever I call on you, on matters of disability, incapacity, and disability, you are the expert that you are. And my new friend, Udireleng, thank you very much.
You're welcome.
Thank you very much, Udireleng. I know we have formed a bond. We will work with that ASSA. Please, I will send you a clip for both days. Share it with the people in the association. And if there's any need in terms of at a professional, intellectual level, I'm availing myself to be of assistance. And I will touch base with the people that have already appeared here. At a time convenient to them, we will extend our hand. So I want to thank you for actually making yourself available for 2 consecutive days on a weekend. Yeah, spring, noch all, when everyone is having fun, spring, where now you are busy with discussions, but it's important discussions. Thank you very much to everybody who has been listening.
Thank you for the.
Thank you.
All right. Thank you. All right.
Bye.
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 Bye.